Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. This show is part of a suite of resources on caring for patients with advanced non-melanoma skin cancer and the social determinants of health. Today, we're looking at barriers to cancer care for these patients living in rural areas and how to leverage the skills of a multidisciplinary team to support patients and their adherence to therapies. Dr. Emily Smith has joined us today to talk about it. She's the Clinical Associate Professor of Pathology and Dermatology at the University of Michigan. Thank you for joining the show, Dr. Smith. What barriers to care do you face working with patients in a rural population?
Oh, yes, absolutely. There are many challenges I think that patients and providers face when navigating patients coming in from a more rural area. I think first and foremost, it's a time commitment and a challenge. The distance between a more remote or rural location and a referral center can be quite great. And so just dedicating the amount of time it takes to drive to a visit can sometimes be prohibitive, taking enough time off of work to get to a visit. Certainly, the travel is quite expensive. And so the greater the mileage, the greater the cost is, especially in this day and age with gas being as expensive as it is. I think another major barrier, though, that I see in many of my patients is sort of a fear or a feeling of, unease when it comes to traveling from a rural area into a more busier or, metropolitan or urban area. And so sometimes that can be enough to keep patients from seeking, referral care outside of their more rural community.
Can measuring social determinants of health impact patient outcomes?
Well, I think that patients who are experiencing, at least in my world, a complex skin cancer, there are so many factors weighing on their decision to seek care and where they're going to seek care. And it can be quite complex, and it takes time, I think, to sort out. We can screen all of we want, but sometimes it takes time beyond a screening tool, a simple screening tool, to really sort out what a barrier might be. And this is where conversations with either myself as the physician or, again, our nursing staff, our navigators, can really help to get to the bottom of each patient's individual story and what specific needs they might have. And again, it's a conversation. There is no direct algorithm that we can use. Every patient's scenario is going to be unique.
How important is it for care providers to build trust with patients?
Oh, I think it's huge. I mean, a patient is not going to buy into any treatment or management plan without trust, without a sense that their care team really has their best interests at heart and really understands their personal medical journey. And so building trust is something that, can happen over the phone before a visit, but certainly is best established in a clinical encounter. And I think that, in my opinion, 75% of a clinical visit often is getting to know the patients and letting them get to know you. So then you can move forward on common ground and really have a fluid care plan. And sometimes trust is very difficult to establish.
Is it important to establish a relationship with the patient's referring provider?
I think it's very important on many different levels. So from the patient's perspective, first and foremost, I think getting back to trust, the patients usually trusted the physician or the provider that referred them in. And so ensuring that we are all on the same page is really, really important. And that comes down to communication. And sometimes it's through a clinical note. Sometimes it's through a quick email, a phone call. Being as accessible as possible to referring providers is really, really important. And so the patients see that. They see that their team is working together, that there aren't any discrepancies, and then they have greater trust in the system going forward. I think it's also important to, getting back to the referring provider, that they feel like they are still involved in the patient's care, even though they've kind of passed it on. So communication by way, again, of, sending clinical documentation back promptly, phone calls go a long ways, and really making sure that referring providers feel that their patient and their patient is getting the care that they need.
What advice do you have for care teams facing similar determinants to health that we've discussed today?
I think really leveraging the assistance of the multidisciplinary team is one of the most important things that we can do. For those of us who are working in the care of complex cancer patients, if you are fortunate enough to work at an institution that has, support such as social work, patient navigators, nurse navigators, these are the individuals to really leverage in assisting and facilitating care for these patients. Now, that's not available to everyone, unfortunately. And so in, certain scenarios, nursing staff or other clinic staff may assume some of these roles. And so I think as the care provider, it's important to know who is going to be owning that piece of the patient's care so that they can be, you can engage them in taking initiative to manage these specific pieces of the patient's care.
Thank you, Dr. Smith. If you'd like to learn more about working with patients with non-melanoma skin cancer and those who live in rural areas, you can check out the links in the show notes for more resources. You can also search the Cancer Buzz feed for a new audio podcast out this week. The topic there is having difficult conversations with this patient population. Cancer Buzz TV is a resource of the Association of Community Cancer Centers, developed to deliver the latest in cancer care news to busy oncology professionals. On behalf of all of us here at Cancer Buzz TV, thank you for watching. I'm Summer Johnson.